know that you will be recorded for this event. All right. So first, thank you so much for joining the NASWTX's 87th legislative session update. Today is April 14th, and we have 46 days left in the 87th legislative session. So first, I'm going to introduce our advocacy team. I'm Allison Moore-Bulware. My pronouns are she, her, hers, and I'm the Government Relations Director. And I'll just go alphabetically by last name. So next is Tessa.
Hello, my name is Tessa Bathar. My pronouns are she, her, hers, and I am a UT MSW student from Austin, UT Austin, and an intern here at NASW.
My name is Jess Riley, and sorry, y'all, can you turn down your volume? Hi, y'all, my name is Jess Riley. My pronouns are she, they, and I am a BSW student at St. Edward's University in Austin, Texas.
Everyone, my name is Allie Smith. My pronouns are she, her, and I am a Texas State University BSW student, and I'll be going to UTA in the fall for my master's.
And hi, everyone. My name is Bree Sowers. My pronouns are she, her, and hers, and I am a grad student pursuing my master's in social work at UT Austin. Nice to see everybody.
All right, so we're very excited to get started. So just a little bit of an update is that Jess and I are actually at the Capitol because we are waiting to testify on two bills that are anti-LGBTQ bills. And so we actually are in the Capitol right now waiting to testify, but so that's partly why there is some weirdness for the feedback is we're both in the same room. So thank you all for being flexible with us. This is session. Of course, when I planned this, we didn't know these bills were going to be up today. So that's an example of just things moving so quickly. But a little bit of background about how NASWTX approaches governmental affairs. I just wanted to remind everyone of this. So first and foremost, it is about building relationships with legislators and other policymakers. This is done through TPACE, through lobbying, as well as working within coalitions and providing policy analysis for legislative offices. Also, we do legislative and regulatory advocacy on behalf of the profession and on issues affecting clients. We always remind people that we are not just here serving social workers, but also the clients that we serve, making sure that everyone within Texas can live fulfilling lives. Another part of our governmental affairs work is educating our members, which is y'all, as well as future members, other social workers, about the legislative process and about policy issues. And this is done through events like Social Work Advocacy Day, which this year was a virtual week-long event, as well as providing updates in our e-news, presentations to NASW branches, classes, and other events, and mentoring students and supervising social work interns. And we also have an advocacy Twitter page, as well as a new software that we're starting to use that you may have heard Tiffany mention earlier called Voter Voice, that we're really trying to use to help our members engage in the advocacy process more smoothly and more easily. So how do we create our legislative priorities? So some of our legislative priorities are continuing professional priorities within the social work profession, such as maintaining our license, trying to ensure that the State Board of Social Work Examiners is functioning, as well as the Behavioral Health Executive Council that oversees our board, as well as other professional issues related to reimbursement rates and things such as that. Also, as members will come to us with an issue that they really care about, and we will think through things to help them figure out if we can work on something related to it. And we give a really good example of this in a little bit that Allie will explain. We also get input from our equity committees. So a reminder, at NASWTX, we have 4 equity committees: the Race, Equity, Accountability, and Leadership Committee, or REAL, the Women's Issues Committee, the Human Rights Committee, and the LGBTQ Committee. We also have our NASWTX board that at the end of the day gives us feedback as well as approves our final legislative priorities, which is a big conversation. So there are many opportunities to give feedback and to help guide our legislative work. All right, Jess, you're up first.
All right, great. So this is HB 226 filed by Representative Bernal, and the companion for this is SB 253 by Menendez's office, and it would effectively define school social work services in the education codes. This bill is especially important this session as the COVID-19 pandemic has highlighted the needs for students both in and out of the classroom. A school social worker, as many of you know, is uniquely trained to provide social work services that identify and address the complex problems to meet the needs of the whole child, their family, and the surrounding community. Defining school social work services can help as more school districts and add school social work services to schools and would refine the scope of practice for over 1,000 social workers currently working in Texas school districts. These services provided by LBSWs, LMSWs, and LCSWs allow teachers and administrators to focus on their work, yet still provides valuable assistance and support to students. Some other things to note about this bill. It was filed last session with identical text and was successfully voted out of both committees, though it did get stuck on the House floor. There is no fiscal note attached to this bill, as it doesn't require school districts to hire school social workers or provide those services, but it definitely can do a lot for us, and we're hoping to get it passed this session. But we are still waiting for a hearing as it has not been set, but has been referred to the Education Committee. Thanks.
Allie.
Yeah, so House Bill 702 was filed by Representative Gonzalez. This bill would actually just bring back the previous requirements for DFPS caseworkers. It would require that newly hired caseworkers possess a bachelor's degree, indicates that consideration should be given to those with a bachelor's or a master's from an accredited college or university in social work or human services. So it doesn't require anyone to be a social worker, just a related field. This would also just help with recruiting more social workers into the CPS system. We're currently waiting to get this for a hearing.
All right, and then we have House Bill 706 by Moody, which its companion is Senate Bill 909 by Powell. This would ensure paid parity for mental health professionals providing psychotherapy, and it would also allow LMSWs under clinical supervision to bill Medicaid. Passing this bill would increase the number of providers available to Texans on Medicaid or with Medicaid, and it particularly in underserved areas. We are waiting to hear get a hearing on this bill.
Hey y'all, so one of the main priorities that I've been working on this session is House Bill 1050 by Representative Romero and the Senate Bill 539, it's companion by Senator Blanco. And so 1050 and 539 would require Texas, specifically the Health and Human Services Commission, to conduct a study evaluating the use of mental health professionals and law enforcement in reducing the number of incarceration rates among individuals that have mental health conditions, intellectual and developmental disabilities, and substance use disorders. And then based on the information from that study and the outcomes found, the state would then be able to draft a report that includes recommendations that really are intended to improve mental health crisis response in Texas and keep Texans safe. So the study is really looking to evaluate which types of behavioral health related emergency calls have been safely resolved by either a mental health professional, a mental health response team, or law enforcement. And the type of community-based outcome, that was the outcome, right? Including preventing individuals from mental health conditions from entering into the criminal legal system and increasing community-based resources, short and long-term referrals. And then based on this program data collected and analyzed in that report, successful practices can be adopted and replicated across the state of Texas to really make sure that the best practices are being used for addressing mental health crises in Texas. And at this time, not unfortunately, I'm just really eager, we are waiting for a hearing. All right, y'all, and then we have House Bill 3553 by Representative Nieve. This bill is going to establish a matching grant program for cities and counties to implement their own mental health and substance use crisis program, or go ahead and expand that type of program that already may exist, really to, again, address mental health crises in their community in collaboration with law enforcement and local mental health authorities. So mobile crisis outreach teams support community engagement and rapport building, leading individuals within a community essentially to be more likely to call MCOTS directly instead of having to resort to calling 911 and law enforcement. And so this bill would really create opportunities for growing the capacity of existing mobile crisis outreach teams while also supporting communities that want to start their own teams. And again, this bill is waiting for a hearing.
Okay, so House Bill 2670 was filed by Guillen. We also have another companion version, Senate Bill 1025 by Senator Lucio. We're really excited about this bill because it would add licensed social workers to the Homes for Texas Heroes program. This program is for people that are interested in becoming a home buyer, and so it provides down payment assistance through grants, which is really, really great news for us. The cool thing about this bill is that one of our members reached out and was actually trying to ask about just different ways they could address student loan forgiveness. And so we were able to find this program, and while it doesn't address student loan forgiveness, this is a really great way to show the essential nature of social workers. So we're very excited about it. This bill was passed unanimously out of committee, which means it's bipartisan, and we're currently waiting to get it a vote on the House floor.
And then we have House Bill 3396 by Mesa and the companion Senate Bill 1275 by West. This bill would add audio-only behavioral health services to Medicaid. It's a very simple bill. We're still waiting to hear and get a hearing on that one. However, there is the same language in House Bill 4 by Price, which is a comprehensive Medicaid bill. It would include audio-only behavioral health services via telehealth in Medicaid. And this is something that's currently being utilized with the Medicaid COVID-19 flexibilities. House Bill 4 by Price has passed out of the House.
All right, let's do an emoji round of applause for the interns. They're all doing such a great job, and I'm so proud to hear them explain the bills that we've been working on together. So a couple of budget priorities that we have. So we do have a Behavioral Health Executive Council budget request. So y'all will be happy to know, as many social workers would like to know and support, there is additional funding for 4 full-time employees, as well as tech updates and infrastructure within the Behavioral Health Executive Council, which does oversee the Texas State Board of Social Work Examiners. So this funding, as written, is currently in the Senate budget. So we are advocating for it to be included in the House budget, so that when the two budgets come together in something called conference committee, that we will ensure that the budget matches and that this funding is included. We are getting very favorable responses when we've been talking to the budget members of that subcommittee on the House side. They're very understanding of the need for more funding for the BHEC. They're very understanding of the backlogs of social workers that have been calling their offices. A lot of folks really understand this because they're hearing from constituents about it. So that's great news. We will continue to watch this, and we will update y'all if anything is needed from y'all's end when that time comes for those budget conversations. And next is maintaining the funding for the Texas Higher Education Coordinating Board Mental Health Loan Repayment Program. As of now, that funding is maintained at at the current level. So all we're doing there is just watching to make sure that that stays the same throughout the rest of the session. So I wanted to go through really briefly, because I know we're running short on time. We want to go through some of the other legislative priorities that haven't been mentioned here, but that really we are working on a breadth of bills supporting other folks, and really some of the priorities that we don't have specific bills for, but that we are working in collaboration with other groups on. So related to transforming child welfare and adult abuse systems, we have really been supporting bills that would help families stay together. So there are a few different bills that we have signed on in support of, that we have dropped cards in support of, that would try to support families before they get to involvement with the child welfare system. We've also been supporting things to try to impact poverty here in Texas. So we've signed on to and supported publicly several bills that would increase access to SNAP benefits, and bills that we've publicly opposed bills that would harm TANF or SNAP or other support systems within Texas. And we have supported bills that would help with adverse childhood experiences, as well as other initiatives within that area. And we also are members of the Child Protection Roundtable, which is a group of child welfare stakeholders, and we generally support the majority of priorities within that group. So ensuring access to needed mental health treatment. So as Tessa explained, we are working on one of our own telehealth bills, but we're also supporting a number of other bills. Their House Bill 4, she already mentioned, as well as the audio only bill. In addition to that, we've supported some bills that would ensure that telehealth and in-person services are paid the same for TDI regulated plans. So those are state regulated plans. We testified in support of that bill last night in the House Insurance Committee. We're also, I meant to add something else here, so I apologize. We're also just signing on and supporting a lot of different bills related to efforts to improve the mental health system. So we've testified in support of schools creating plans to support the student mental health needs after a crisis. We've also dropped cards of support on suicide prevention bills, as well as a number of other initiatives. And we did testify in support of a bill that would add suicide prevention hotline data to the back of student ID cards, 6th grade and up. So kind of a few different initiatives going on there. We are also very supportive of any Medicaid and CHIP changes and Medicaid eligibility. So we've supported a number of bills in that arena. Actually today, two great bills passed out of the House that we supported both of. One would extend Medicaid coverage for moms from 60 days postpartum to a year. That bill was voted out of the House, as well as continuous eligibility coverage for without monthly income checks for children in Medicaid. That bill was voted out of the House today. We do have an immigration item on our legislative priorities. There haven't really been very many bills related to immigration here, but we are watching and looking for what our partners are supporting. For this next item, we've really weighed in on ensuring that we protect the civil rights of all Texans, including LGBTQ+ Texans. Earlier this week, we publicly testified against a bill that would have determined gender affirming care as child abuse, and we shared the social work perspective on why we believe that's harmful. Jess and I are actually waiting to testify against two bills today. One that could allow for discrimination of LGBTQ Texans from healthcare professionals, and then the other one that would remove liability protections for healthcare professionals who provide gender affirming care. So we're very much following the lead of our LGBTQ partner groups and really stepping in to try to fight back against some of these really terrible and hateful bills. We're also working with partners on police reform to promote anti-racist practices. So we have supported bills that are moving forward in that realm that really, again, we're looking to see what our partners are supporting and trying to follow the community voice there. So we have dropped cards of support on good bills. There were a number of bills last week related to people experiencing homelessness that we talked to some of the experts on and dropped cards in support of that. We're also kind of following, there are a lot of really bad voting bills this session. And as y'all can imagine, we've been submitting letters of opposition as well as dropping cards against those and trying to, again, follow our partners' leads on that because they are really the experts. All right, so I'm going to take it away from sharing the screen and just open it up for questions for the last 8 minutes or so. Does anyone have a question? Feel free to put it in the chat or it looks.
So how come all the bills that we like the most can't get any hearings, and what can we do to make that happen?
Well, that's a good question, Tiff. So first off, because of COVID, they started hearings later than they normally would. And then because of the week-long snowstorm where Texans didn't have power and half of the NASW staff didn't have power or water, there were no hearings that week at all. So just kind of imagine that normally the entire month of February, bills would have started hearings, and this session, they didn't even start until March. So we're already behind. Also, fewer bills this session are getting hearings. I would just say everything is slow this session. It's kind of just the common knowledge. Like, I mean, it's kind of common amongst the advocates that we're all feeling this. It's not just us, but we've really been trying to follow, we're fighting hard to try to get our bills hearings. There are several that we're being told will come up next week, but there's also just the realities of the session that we're working in. And this is just a harder culture of a session to get bills heard. So what you do is there are some things that we're going to talk about. I think talking to the committee chairs that our bills are referred to and telling them that you would like for the bills to be set. You can also talk to your representative or senator and tell them that you would like for them to advocate for that bill to be set for a hearing. If you live in the district where the bill author is, you can let them know that you're supportive of the bill and ask them what they can do. Those are the places that I would recommend starting. Any other questions?
I have another question.
Okay.
How can we follow this? It's so much. Like, I'm so pleased that we have all of the students and that we have you to do the work full time. I mean, that's awesome, but it's too much for me to keep up with. I'm following the Twitter advocacy page, like I'm following y'all's Facebook page. I'm following the emails. I'm trying to get everything out to my branch in a timely manner. Do you have any suggestions and thoughts on how we can get our social workers in our districts informed in a timely manner as branch chairs, I guess?
No, I appreciate that. And I think that honestly, this is something that I think is kind of it's hard for a lot of people that aren't doing this work every day, living and breathing it, to stay up. So, it's just a very tough thing to do with how quickly bills are set for hearings, how quickly things move. I mean, we will find out on Wednesday or Thursday that a bill will be up next Monday, Tuesday. So it is a really quick turnaround. Honestly, I think that I would recommend, at least for following what we're doing, I think you're following all the right avenues. We really are trying to use the advocacy Twitter. I also do video updates for our monthly e-news, but I know that that is something that is only monthly. So we are trying to think of other ways to keep our members informed, but I really think the advocacy Twitter is one of the best ways to know what we're up to, because I talk a lot on there about like what we're supporting each day. I'll say like, we're supporting this. We, testified for this. And, now that we have voter voice up and running, if there is an ask that we have of our members, it will be sent out through that medium so that people can advocate quickly and easily that way. So Denise asked, what committee does House Bill 1050 and Senate Bill 539 and House Bill 3553? Those are all in the House Public Health Committee. And on the Senate side, it would be the Senate Health and Human Services Committee. All right, just a few more minutes. Oh, another question came in. Do you see more opportunities for social workers to work in paid political social work positions in the next 5 years? That's a good question. Well, I will say that there are a lot of social workers that work in and around the Capitol. So we would love to see more social workers in these types of roles. There are a lot of social workers that, sometimes it's as simple as talking to someone that works in an office if you want to work in a legislative office, or trying to apply for different jobs within the field, trying to start maybe volunteering or, grow more advocacy skills while you're, if you are a student before you get to that level, maybe trying to pick a final field placement or internship that is in the advocacy world. I think in the next 5 years, I mean, Will, you can add to this, but I feel like I see that there have been a lot of social workers working in and around the Capitol, and I feel that there are a lot more in the last couple of years. It seems like people really want to do this work and want to stay engaged with it. And Barb had a really great point in the chat. Barb said, I participate in multiple advocacy groups and gather information from different sources. All right, just a couple more minutes. We are going to really stick to 30 minutes. So anything else that y'all would like to ask?
Hey, this is Nakia. I'm just wondering what's going on, y'all. I'm wondering what are some of the bills that are really heinous that are likely to get out of committee and to be actually getting onto the House floor that we can help slow down and stop or yell at people about, and not necessarily specifically for social workers, but also for our clients.
Yes, great question. So I'd say the two worst voter suppression bills are House Bill 6 and Senate Bill 7. I know that House Bill 6 was voted out of committee, but I don't believe that it's been heard on the floor yet. I know Senate Bill 7 has been voted out of the Senate, but it hasn't been heard in the House yet. As far as anti-LGBTQ bills, Senate Bill 29, which is related to banning trans youth from UIL sports, that was heard in the Senate today. So that'll most likely be coming over to the House where we can fight it in the House. Then there's House Bill 1424, which we're waiting to testify on. And that one would allow healthcare professionals to discriminate based on their beliefs. That one hasn't been voted out of committee though. And then House Bill 1399, which would remove liability protections for gender affirming care. Those are two that I would definitely be watching as well. I'd love to give it up for the interns. Do y'all have any bills that y'all would add to share with Nakia that you think we should be watching?
I just put in the chat House Bill 1675, which I believe had a hearing this week. I believe it was today. So I don't know what the vote was on that, but that one's about disability guardianship, and a lot of disability advocates are really against that at the time.
That's great, thank y'all.
And I'm also going to throw a few in the chat. There are a lot of anti-abortion bills through the session, so I'm going to put those in the chat as well. And really how we're able to learn about bills that we oppose is through following a lot of different advocacy groups and staying on their listserv. And typically by week, they'll send out a list of bills they don't support and legislative updates as well, which is really helpful.
Can you put those in the chat box?
Yes, let me get some stuff together. BRB.
I'm trying to understand. Will, if you want to speak up. Will texted me something and I'm not sure I'm totally understanding.
I know that the governor made it a priority to try to clamp down on local municipalities that try to divert funds away from law enforcement to other areas. I just didn't know if there was any movement on that issue, if there are any bills, or if there's anything in the budget that would impact.
I know that several bills have been filed, but I haven't seen that any of them have been set for hearing yet. Yeah, thank y'all amazing interns for sharing information in the chat. These are groups that we really follow a lot. So, you know, again, really recognizing that we can't be the experts on everything. So how can we best support our partners who really are the experts on things? And so we really do follow what our partners are working on and trying to uplift their voices and sign on to their efforts to collaborative work. Well, thank you all so much for joining. This has been a fast and furious 30 minutes. We will probably do another one of these before the end of the session, but I learned a lesson not to do it on a Wednesday. So I might do it on a Friday next time. Thank you all so much for being here. And a big round of applause to our interns for all of the work that they're doing. And if you're not a member of NASWTX, we do encourage you to join, because these efforts are because of y'all, and we are really here supporting both our social work voice and also really out in front trying to support the clients that we serve. So thank y'all for being here, and we hope that everyone has a good rest of the week.
Knock 'em dead testifying.